Welcome to this Bitesize Wound Club online education module on local infection, sepsis strategy in clinical practice, which forms part of a series of modules you can access to develop your knowledge and understanding around infection management. My name is Danielle Briggs. I'm a complex wound specialist here at Smith+Nephew. Today we will be discussing the treatment and management of sepsis in clinical practice. By the end of the module, you'll be able to describe the prevalence of sepsis globally and in the UK, the main risk factors and red flags that raise a strong suspicion of sepsis, how to manage people with suspected sepsis and the sepsis 6, and where to find more detailed information. The global burden of sepsis is staggering. Every year, 49 million people around the globe develop sepsis, and the disease claims 11 million lives. That is the equivalent of one death caused by sepsis every 3 seconds. In the UK alone, every year, it is estimated that 245,000 people are affected by sepsis, which is more than the number of people in the UK who suffer a myocardial infarction or heart attack. These individuals are obviously all very unwell, and many will present to A&E. Around 5% of all emergency admissions in the UK are due to sepsis. Given the severity and rapid course of the disease, the mortality rate associated with sepsis is high. Around 20% of patients will not survive, leading to 52,000 deaths per year in the UK alone. That is 5 people in every single hour of every single day. More people die of sepsis in the UK than die of breast, bowel and prostate cancer combined. These figures are also highly likely to even be underestimates, since a proportion of the more than 1.7 million patients suffering from a severe infection in England every year are actually likely to have uncoded sepsis. But the human burden of sepsis doesn't stop there. Many of those who survive suffer permanent, life-changing after effects. These can be really debilitating and can include post-traumatic stress disorder, cognitive problems, chronic pain and continued organ dysfunction. So even if a person's life is saved, the burden of survival could mean that sufferers are unable to return to normal and may not be able to return to work. In the UK, every year, sepsis is estimated to cost between £1.5 and £2 billion in direct costs to the NHS alone. This is more than the annual cost of asthma, which costs more than £1.1 billion in the UK. With the added costs to the wider economy, the bill increases to somewhere between 11 and 15.6 billion. So the burden of sepsis is really high, both in human and economic terms. The reality is that much of this high burden is avoidable. If it is caught early enough, sepsis is easily treatable. The key is early diagnosis and timely administration of treatment. So, how is sepsis identified? Sepsis can look different in different people, and symptoms might present as flu-like, gastroenteritis, or a chest infection. Not everyone will have a high temperature, especially in the very early stages. Sepsis presents differently in children than in adults, but experts have condensed down the key things to look out for, so it's really important to be alert for the different elements shown on this slide. Patients with certain risk factors are more likely to develop sepsis. This includes the very young and the very old who are at risk, as are women who are pregnant, have recently given birth or miscarried. Treatments for other diseases can also increase the risk of developing sepsis. For example, people undergoing chemotherapy or those who are taking steroids or immunomodulating drugs are at greater risk. Also at risk are people who have a break in the skin, for example, an indwelling catheter, recent surgery, or any kind of wound. Early warning scores like News2 are widely used in UK hospitals and can be very useful. A News2 score of greater than 5 should always trigger a screen for sepsis. Finally, the red flag system developed by the UK Sepsis Trust in collaboration with the Royal Colleges and NHS England, and since endorsed by NICE, can also be a useful way to assess a patient's risk of deterioration. This red flag system is understood to be used by around 90% of the hospitals in the UK. The red flag system is not a formal diagnostic tool for sepsis. It's a set of criteria which can be rapidly measured, which suggests it is highly likely that the patient has a degree of organ dysfunction, and it empowers health professionals of any level of seniority to act. If you identify one or more red flags, you should assume the patient has sepsis. And this red flag empowers you to act immediately. It's a tool designed to help you to get on and ensure the patient gets the treatment that they need. NICE guidelines also include a series of amber flags, less urgent in terms of triggering action, but still very important in terms of understanding the patient's risk of deterioration. The red flags shown here are the ones for adults and children over the age of 12, and they include a new or altered mental state, being unable to stand or being collapsed, being unable to catch their breath or a high respiratory rate, skin that is very pale, mottled, ashen, or blue, a rash that doesn't fade when pressed, recent chemotherapy, or not having passed any urine in the previous 18 hours. If a person presents with signs or symptoms that indicate a possible infection, always think, could this be sepsis? Sepsis can progress very rapidly. It's so important to have a high index of suspicion and act immediately on any of those suspicions. Once you have identified that a patient may have sepsis and may be at risk of deterioration, urgent action is required. NICE and the Sepsis Trust have published guidelines for the management of these patients. Any patient with a red flag of sepsis should be urgently admitted to hospital wherever possible. Once admitted, treatment should be initiated immediately. Treatment is described by the Sepsis treatment protocol shown here in pink. The most important point is that the items shown in the Sepsis treatment protocol are the initial required treatment and should all be carried out within the first hour after admission. Time really is of the essence where sepsis is concerned. Briefly, given the potential for rapid deterioration, any red flag is a trigger to involve a senior clinician. Oxygen should be given if the oxygen saturations of your patient are less than 92%. IV access should be obtained, and blood samples, which should include a lactate, need to be taken and sent for analysis. Intravenous antibiotics should be started immediately, and these should be a broad-spectrum antibiotic administered at the maximum appropriate dose for your patient and according to your hospital's local protocol. Intravenous fluids may be necessary, and finally, the patient must be carefully and frequently monitored, for example, by using the News2 system to assess their risk of further deterioration. Since its inception, the Sepsis treatment protocol has grown in popularity and is now used in more than 99% of UK hospitals as a tool to help ensure appropriate treatment. There are lots of resources available describing the content of this module in more detail. The UK Sepsis Trust is a charity that exists to fight sepsis, stop preventable deaths, and support those affected by sepsis, and their website has lots of useful information. NICE has also published guidance around the recognition, diagnosis, and early management of sepsis, which is freely available from their website. To check your knowledge and understanding, try and answer the quiz questions. Well done! You have now completed this bite-sized module. Take the time to reflect on how you will take some of what you learned and apply it in your daily practice. Please click on the link in the description below to go to the full 15-minute version of this presentation. Once this is completed, you will have the opportunity to download CPD revalidation forms. Thank you for your time today, and please remember to look at the other sections to access additional modules to help you on your learning journey.